So now we're going to talk about something that I think everybody has in some form or another. We're going to talk about addiction and mental health issues. And so that's been the thing that I found the most challenging to work with clients. And then, by working with people, you discover that everybody's got some form of that. And why do people have, especially, let's say, addiction? What is behind that? Now, I've come up with some theories, and they work with a lot of people, but that doesn't mean it's going to work with everybody. So as I'm talking about it, keep in mind that these are the things I'm aware of, and that doesn't mean it's going to fit for everybody that you see or for yourself necessarily. But one thing I found is that, for example, with food sensitivities, I found that I had a really difficult time as a younger person eating like corn chips because there's something about corn that made me want to eat a lot of it. So I had to really give that up. Same with things like if I would do something with sugar, too much sugar, it was all of a sudden I'd crave more of it. Which you could say we talked about earlier that these parasites like Candida were allowing me to crave it. There's different things like that we can think of too. But what I have found is that typically when you're craving something, it means that typically it's not good for you. And that there's some reason behind it. So anything you crave, even alcohol, I think that's a sugar addiction. That's kind of my theory about it. And I'm sure there's other things too. I mean, that's one thing. But even, for example, other addictions. Like I find that if I'm worrying a lot, if I'm thinking like repeatedly about something, that's the type of an addiction. And I find that I need to get to the root of what's causing it. And so if I'm finding myself ruminating too much about something, typically that means that there's some adverse thing that's in my past that's driving it. So you could say that when you really crave something or keep thinking about something, that there's something behind it. So for example, if I'm thinking a lot about something, I'll go into what's going on with my body and get a sense of what's happening with that, because that may tell me why I'm ruminating so much. Like, what's that about? Typically, like Erica was talking about, a lot of times it's something that could happen in childhood and or things in the ancestry and other lifetimes. But a lot of things that are really ingrained have to do with childhood. So, for example, if you're ruminating about something, typically there's an incident that happened in childhood that you could even go back to your ancestry and so forth that is driving it. And I might have, let's say, some stomach issues because of it. So if I pay attention, if I'm thinking, okay, I'm ruminating a lot, where else am I feeling this in my body, this addiction of thought? It would be, let's say I'm checking on my gut, I might go into it, like imagine that I'm like even a little me is going in there to investigate, or I'm just focused on my gut area. And I may see something in childhood, or I may just get a sense of something that happened. And by getting in touch with it and staying with it with my body, typically when you stay with something, it starts releasing. It's like whatever you resist persists, and whatever you just stay with typically will let go. If it's something really big, it's hard to do it on your own. You may need somebody else to help you. But what I find is when I get to the root cause, the rumination will go away. It's almost like the body or the brain's way of saying there's something that you need to pay attention to. If something is too much, there's something going on with that. What I have found too, and I haven't worked very much with this, so this is just a narrow kind of sample of what I've seen, but for example, even sex addiction. I remember there was a man that came in that had sex addictions that really wanted to change that because it was getting to be too much for him. So what I found is that a lot of times with that, there's some sort of sexual abuse somewhere, and men aren't supposed to be abused in our culture according to the myth. And so a lot of times guys don't want to admit that it's happened. And I have to say that a lot of the guys that I've seen, not all of them, but many of them have been sexually abused and they don't want to talk about it. They turn it into something else, like, oh, it was fine, it gave me experience or whatever. But basically, no, it really didn't. So what I found is that when people have those kind of sexual abuse experiences, either they crave more. It's almost like the body's, wants more of it. Almost like the brain is saying there's something out of balance. There's something out of balance. Or sometimes people don't want to have anything to do with it because they haven't dealt with something. It usually goes one way or the other. So what I found is if you can get to the root cause of why you want something too much or you're just totally adverse to it, that a lot of times will move out whatever those cravings or addictions are. Like with the food example, sometimes you just can't do that food, or you can't do that alcohol, or you can't do whatever it is because there's something that your body just can't handle it. It's just not, doesn't have an enzyme, it doesn't have something that can deal with it. And like Erica said, what's one person's really good, healthy choice might be somebody else's poison. So it's all varies with each individual. So that's what I found with some things with addiction. Also, I've seen with that, as far as on an energy level, you know, besides looking for what caused this in childhood and then with the ancestry and other lifetimes and working with that, I found again, almost like these little parasites again. So a lot of times with addiction, I've seen things like a spider or a tarantula. And to me, that's my symbol that there's some sort of an addiction there, whether it be, again, thought or food or alcohol or drugs, whatever it may be. Excess worry is, you know, all of that kind of thing. And so what I'll do is typically try to move that out, almost like an entity. So I'll go in there and ask to kind of splice out, which would be like edit that from the field, you know, encapsulate it and move it out. And actually you can enlist the person to go in there and start shifting it out as well. A lot of times if you get the hit that there's some sort of, let's say, addiction with a person, it's best to have them find their own answers as to what the root cause is, unless it's something kind of general, because, like, for example, you'd never tell somebody, you know, I think you were sexually abused, or, you know, did something really, like, gruesome happen, you know, you may see something, but you can't, you got to have the person figure it out on their own when it's something really significant, because if they're not ready for it, for example, it can be too much. Sometimes you can ask, you know, did anything happen at a certain age? Like, geez, did anything happen at age 5 that you remember? What, like, if you picture yourself at age 5, you know, how do you feel? Sometimes people will say, I don't remember anything from childhood. You know, all of a sudden it's like, okay, if you don't remember anything, that's a red flag, because you should typically, you know, you'll remember at least some things. Everybody's going to forget, you know, things here and there and all that. But so a lot of times, if you find that, especially if you're somebody that's working with people, unless you're a therapist yourself, you're probably going to want to refer them out. Even though I've got my graduate degree and I, you know, and have done a lot in the psychology, grad degree in the psychology department, I would probably, if it's something real significant that somebody needs a lot of help with, I'd also want them to go see somebody that's licensed. But because I've been trained with trauma and recovery, I would feel comfortable working with it. But somebody else to work with it too if it's really significant. Because somebody who's doing regular therapy is going to work differently than, let's say, somebody that's doing it on an energy level. And there's a lot of different skilled people that can work with it in different ways. So, and with addiction too, a lot of times if you're looking at the ancestors, you can find that typically going back in time, there's going to be people in the ancestry that have like either a really worry complex, which would be one form of addiction, like an anxiety worry. You may find that in the ancestry there's like a lot of alcoholism and things like that. And so we talked about going into, let's say, the ancestry. Even have you imagine along with the client or patient imagining that, you know, that the ancestry is in front of them, and you can kind of get a sense of like how many generations back may this go. And so you may find, let's say you get 4 generations back, and a lot of times what I'll do is, let's say if I get it's 4 generations back from, let's say, Erica, who is just speaking here, I typically take, and this is just an approximate, like 20 years for every generation from the time she was born. Let's say that Erica is born in, let's say, 72, for example, you know, whatever that is, then you go back, let's say 20, 40, 60, 80 years, 80 to 100 years from that, which would be, let's say, roughly in the mid to late 1800s, let's say. And so some people know their ancestry, and they'll say, yeah, you know, there was something there. You might even get a little snippet. I think it's fine to kind of try to give an idea of what you're sensing and have them sense too what's going on with their ancestry. That's a kind of an in for understanding what's going on with childhood or in the current life. It's a safer way to approach too. And so then what we've done before too is to find out like what the scenario was. They may know of some things too on what happened. You might even find out that there's something where, let's say a potato famine in Ireland, all of a sudden the whole family is leaving Ireland during a certain period of time. You may see them getting on a boat and leaving a particular country, and they'll say, yeah, that's about when my ancestors came here. Well, there was so much grief and loss, let's say, that they started using, let's say, substances to cover up the grief and loss. Sometimes it can be self-medication. And if you can release the original grief from that ancestor by crossing souls over that haven't crossed, by by clearing the trauma out of the field. A lot of times there can be, like we talked about, almost like a scar tissue or a break in the energy field that is there due to the trauma and difficulties. If you, in a sense, unweave, splice out, delete any of those things and repair the energy field and do all this crossing over, that all of a sudden the person can feel quite a bit different after doing the work on the ancestry. So it's easier for them to really do their own work in the here and now. And same with past lives. And every once in a while somebody's their own ancestor too, which is a double whammy. If somebody's been their own ancestor, and let's say that they started a pattern by crossing over them as the ancestor or somebody close to them that's an ancestor, that can make a huge shift in how a person feels. So, and what I found too, like an example with anxiety, there's a woman that I'm working with, Nancy Van Dyken, who's the psychologist that wrote a book. Probably a lot of you have heard me talk about the everyday narcissist or everyday narcissism. So she's written a book on that with the 5 myths that she's gotten out there pretty big right now. And so she's somebody that is really interested in energy. So her and I have been working with some of her clients when they get permission to see how energy work works along with therapy. And so she had a man that has had just a ton of anxiety, a lot of guilt and shame that he couldn't really understand, so much that he had a hard time even going to the grocery store. He would feel like everybody was looking at him. He had a hard time saying no to anybody. He couldn't say no. If it was almost like he just couldn't do it. And so she said, he's got such a mental health issue here. He's given us permission. Can you take a look and see what's going on? And so what we found was there was like 5 different lifetimes where, or maybe it was 4 or 5 lifetimes where he had been in a situation where somebody died through some significant horrible death, where I think all of them but one, he felt responsible for it. Like one time he set up a bear trap in a life and his son ended up getting into the bear trap and dying because of it. So that was one of them. There was another one, God, if I can remember them, where he was drinking or something in this lifetime and hit somebody who ended up dying, and it was like an accident kind of a thing, but he was like out of his mind. I think he had one where he had PTSD where somebody was brutally hurt, or maybe he was. But there were all these kinds of things. So by working with crossing over the souls that hadn't crossed over, we had to repair their energy field because they had died in a really tragic way, bring their spirit back in, cross them over, and repair the energy field and so forth. Now, he didn't know what lifetimes we were working on. We did this without him being there because he gave us permission. And she said that the next day that she saw him, he all of a sudden he made an appointment to be able to go do some major work at this program called On Site. He was able to actually go out of the house and feel fine. He was saying no to people, and she said that's continued on for quite a while now, that just working with those particular lifetimes made a significant reduction in his anxiety. Now, not to say that would happen with everybody, because everybody's different. So, but it's an interesting study to see how certain things can really affect how you're feeling about things in your life. So that was a really huge one. And so then there's another person that we were working with that has extreme anxiety and always feels trapped in their life, trapped. So what we ended up doing is finding, I think there were 5 lifetimes simultaneous. Most of them were simultaneous, where this person was trapped. Either, I remember one time it was like almost trapped in a jail. It was some sort of kind of almost like back in the Protestant Catholic days, where if you weren't on the right side of the religious fence, then you would get jailed for it, or even tortured and killed because you weren't Catholic, or because you weren't Protestant, or because you were pagan and not Catholic, those kinds of things. We went back and forth on torturing and killing people if they didn't believe what we thought they should believe. So this was a similar thing. And he had other lifetimes like that. So we worked on these 5 different simultaneous lifetimes where he was trapped. And he hasn't talked about being trapped since. And this was probably about 2 or 3 weeks ago. So, so it hasn't been a long process of seeing it, but what I have found over the years is that if you work on something that has nothing to do with their current life and shift it in these ways, that it can help their mental health significantly improve. And then it's easier for them to work on the current life. So, is a lot of what can cause some of these difficult, like different addictions and mental health type of issues. And so, one of the things I found too that can feed and keep addictions going too, or which a lot of it can be ruminations, is if we're holding on to other people's energies. And I know that's been a topic that you probably heard about for years, but it was kind of interesting because I've always seen a lot of cordings with people and so forth. Like for example, somebody may be corded to your hip or to your second chakra, another person, and you're feeling their energy because you have something unresolved with them. Typically that's why it's there. It's like an unresolved situation. But what I was seeing is that if a person feels guilty or unresolved, that person's energy can almost be woven in as a parasite in their system. And it's almost like a dormant or invisible kind of thing. And I've been noticing that more and more. So maybe you can't stop thinking about that person, what happened, because it's almost like your energy fields are intertwined. And that it's the body saying to you, there's something out of balance. There's something you need to pay attention to. If your mind's ruminating, if your emotions are really intense and upset, it's your mental, emotional, and physical body saying that you need to do something to make a change with that. And so when you think about that, if anybody does anybody have any comments or questions on that? Anything you've noticed in terms of mental health or addiction? Yes, Nancy.
I'm working with a 10-year-old girl who has addiction, who has terrible anxiety.
Mm-hmm.
Her dad has even more terrible anxiety. So the mom and I are doing work, and I'm including the whole family.
Good.
And after one session, I had no clue the result of it, but she was telling me just this week how she's noticing her husband is like so much calmer in all kinds of different ways. So we did another session on Friday, and we cleared, this girl has, I measured it like 4 out of 10 of anxiety. Her dad is 6 out of 10 of anxiety, so it's pretty significant.
Yeah.
And we removed many past lives, or crossed over many past lives, and every one of them had anxiety.
Mm-hmm.
Every one of them.
That's what happens.
I can't wait to talk to her next week. Literally to see. And what was interesting, of course, his ancestors are the daughter's ancestors.
For sure.
So I cleared her stuff first, and then I went to clear the dad's, and there was nothing left because we had kind of gotten all of it. And this woman is like just loving this work because she's seeing the work and she's seeing the difference already. Mm-hmm. So I'm so excited for this little 10-year-old. I said to the mom, you have no idea the gift you're giving your daughter. This is so cool.
Mm-hmm. Yeah. And that's kind of when I got clued in about this whole crossing over thing, and I started doing a lot of it and teaching a lot of it, is I went to a workshop in New York. It was probably in 2008. And God, I can't think of the name of the guy now, but he's somebody that's had like 4 major near-death experiences and has written books on it. And I remember he had one near-death experience, if anybody knows who I'm talking about here, but he had one near-death experience that was all medical kind of related things, where he was in the hospital, where he went to the afterlife and had an experience where he said there were so many people that haven't crossed over that he was really shocked. And he said there's so much toxicity because of all these souls not crossing over. He says it's a major problem. We need to cross these souls over. And that stuck into my head. And then all of a sudden when I started noticing all these ancestors that haven't crossed, all these lifetimes, I thought, this guy really made me think about it. We all kind of help think about different things by what we say. Somebody says something, then it makes you think about something else, and makes you think about something else. And so that's what kind of kick-started that one off for me. And then just noticing, like Nancy was saying, if you notice that, like somebody says, geez, everybody in my, I've got my husband, like she said, her husband was super anxious and so was the daughter. So you could say it's an inherited thing. Well, that's a good clue that you definitely want to work on the ancestry, for sure. And any lifetimes that those ancestors have been in together. And not to say you wouldn't want them to seek other help. Obviously you don't want to be, make them think that you're the be-all, but in some cases it is the be-all, and in other cases they need other things. So I always encourage people to go out and try lots of different things so that they can make sure that they're covering all the bases. So what we're going to do is we're going to be doing some guided imagery to be able to do some clearing up of these things so that you can listen to it every, when you're sleeping or drifting off to sleep. So we're going to be working on having you focus in on, is there anything in your ancestry that fits with addiction or mental health? Are there any past lives, any simultaneous lives? And I'm a little careful with the current because, you want to make sure that it's something a person can handle. So we'll just say, safely, if is there anything in your current life that you can be safe to know right now that can help you understand where some of any sort of addiction, which can be thinking. I'd have to say mine is certain foods, and my thinking can be like that, the rumination thing. And a lot of the time I don't feel worried or have that happen, but it's always a sure sign that if I get that rumination going, there's something to look at. So what is it that you need to look at, and where is it coming from? Current, ancestry, past, and simultaneous. So we're going to take a look at that both for mental health and addiction. And of course, most people, not everybody, of course, this is a generalization, a lot of people with mental health issues will have addictions just because it's a self-medication type of thing. But a lot of people that have it don't use anything either. But they tend to find that they can go together. So we're going to work with them both in a guided imagery format. Anybody else want to say anything about that before we start, or give any comments?
I have one other little comment.
Oh, sure. Go ahead, Nancy.
So I wanted to comment on this because I thought this was really interesting.
Mm-hmm.
The woman whose daughter I'm working with, I said, has your husband ever wanted to get help? She says, no, he doesn't really want to. And she said, he would never come to get help from you. And I said, okay. I said, well, we'll just see if his higher self wants to join us. And he was there first time, every time. So I said to her, do you think it's because he just doesn't want to take time out of his day to go get help? And she says, I think so. So it's been great. I said, well, okay, we can do your whole family all at once here.
No, that's exactly right, because you defaulted to the higher self, like Nancy's talking about, because he hasn't said, okay, I'm coming in for a session, but because you're working with all the ancestors, and he's an ancestor, and you're defaulting it to the higher self, you can just say, okay, who's ever here that is accepting this help, they can take it on. And a lot of times, like you said, they don't even necessarily know. If you're working with their ancestors because of the daughter who's there, everybody benefits because we're all interconnected.